give the next talk, which is how to give an amazing talk. He changed. That was my editorialization of what he's going to do, because I think it's one of the more important talks I think you'll get during the year. The more part of the how-to series. You'll also have somebody to give you a talk on how to publish and write and so on as well. So Quinny is a professor of medicine and in the division of hospital medicine, and he's been a fantastic clinician, educator throughout the years, and somebody who I've gotten to know well even since I was a resident here. So thanks again.
Thank you for inviting me, Peter. So one thing you're going to realize as you progress through your careers is as you get on, more and more of your communications are going to be done in the form of giving talks. And it's one of those things, you've seen a lot of great talks, you've seen some talks that probably weren't so great as well, and in your mind you may have some vague sense of why this talk was good, why this talk was bad, this was exciting, this was boring, this one was silly, whatever. What I'm going to try to do today is codify some of the strategies that have been shown to lead to better, more interesting, more effective talks, and kind of put them down on paper. A lot of what I'm going to say is going to be very intuitive, something that you say, well, geez, thanks, Dr. Cheng, you master of the obvious here. But I think actually seeing it on a PowerPoint slide will tell you, yes, in fact, your impression that this talk was better because they picked the right content from this particular audience. Yes, that's true, and hopefully by looking at all this, we can make your talks more effective as well. So this is the basic outline of my talks, 3 general sections. First section is how to make your talk interesting and relevant. In other words, how to pick material that is appropriate for the audience at hand. Second of all, make it clear and simple. And this is where I think a lot of otherwise good talks could get into trouble. Too many talks are not clear. Too many talks are not simple and easy to follow, and this comes in, especially when the data slides start coming in, people start getting lost during that process. And we're going to try to go through some strategies that make presenting data more easy for the audience to understand. And finally, probably the most subjective part of this talk is part 3, look good and entertain the audience. And this is very subjective, this kind of my own biases built into here. How to make your slides look better, how to be more entertaining and more engaging for your particular audience. So with that in mind, let's get on here. Part 1, make the talk relevant. Make it appropriate for your audience. And we'll talk about knowing what your audience wants, choosing the right content for that particular audience, capturing attention at the beginning of your talk, and then formulating learning points. So obviously, if you want to make your talk relevant for the audience, you need to ask yourself, who is my audience? Who am I talking to? And there are a lot of ways you can try to categorize your audience. I put it in 3 kind of general dichotomous groups here. First of all, are they trainees versus people in practice? That's going to be relevant. Trainees are going to need more background information. They're going to need things that are more basic level. Whereas if you're talking about practicing physicians, you can cut to the chase, cut to the meat of your talk a lot more quickly. Are you talking to academic types at a university setting? Or are you talking to doctors in community practice? You're going to want 2 different things. Academic doctors are going to be more interested in some of the details of the data. They're going to ask maybe a little more pressing questions about p-values and stuff like that. Community physicians want practical advice. They're seeing patients, 20, 25 patients a day, say. They want to know how to take care of that next patient quickly and get some practical pearls from you. Are they generalists versus subspecialists? You're talking to a primary care audience or a general medicine audience, people who didn't go through a subsequent post-residency fellowship. They're going to have different goals. They're going to have different tolerances for things like basic science. Whereas people who've done subspecialty training, they've all done some type of science research as part of their career and they're part of their education. So they're going to have a different tolerance for that. What does that mean? Well, what is the audience's experience? How much background information do you need to give? So we've already mentioned trainees, you're going to need to give a lot more background information before you talk about the parts that to you are the most interesting. And what do they want? How many people love basic science talks? There's got to be a couple basic scientists in the room. Yeah, got a couple here. Recognize though that you're the exception. And the vast majority of the world, especially most physicians, are not going to have that much tolerance for basic science. So that gel that goes up on the screen, eyes are going to glaze over. That doesn't mean you can't show it, but your work is cut out for you when you are going to present that Western blot or whatever it's going to be. How much data to present? Again, it's a general rule for talks, no data and too much data are both, the the sign of death here. Somewhere in the middle is the right amount of data to present for a talk, and you gotta decide how much to give. Basics, a community audience probably gonna want less data than an academic group who are doing talks of a similar nature to what you're doing and they wanna see your data. And then finally, are you giving a practical talk where you are giving firm advice, like the next time you see a patient come into your clinic who has eczema, say, these are 3 things you should remember and 3 mistakes you should not make. Practical, pragmatic advice. Or are you giving a more broader, thought-provoking talk? Some of you who've seen the, what are called TED Talks on the internet, things like that? Yeah. So they're not going to give you any practical advice there. They're just kind of entertaining you, making you think, that was interesting. And those are perfectly fine talks, especially for an academic audience. The general audience, the general practitioner in the community who wants to come in and leave with information on how to treat the next patient may not find that so relevant. The very first talks I gave were probably too thought-provoking and not practical enough, and when I brought them to a more community audience, I needed to realize to peel back some of the big ideas and focus really in on more hardcore basic facts that are going to help physicians practice. And then capturing attention. If you know your audience, you might know some strategies that can be effective at getting them interested in your topic. So how do you capture attention? You're getting at the talk, how do you make this talk appear interesting to your audience member? A couple of strategies. These are common things that people do to begin their talk off. Number one, a case. If you're talking to a group of physicians, practicing physicians, a case is a very effective way of getting things started for a couple reasons. First of all, in training, every physician has gone through had the experience of sitting in an audience like yourselves, and one of their senior trainers, the residency director or whoever, chief resident, goes over to the board and starts to present a case. And they realize that within a few seconds, that person's going to turn around and say, "So, Michael, what do you think's going on here?" And if they weren't paying attention when you were writing about this 45-year-old man with a history of 3 weeks of fever and a rash on his hands, if they weren't paying attention, they were going to get called on and be embarrassed in front of all their colleagues and look like a fool. So when you put a case on the board, anyone who's a physician, a reptilian part of their brain kicks in and says, "Oh, geez, I really got to pay attention now or I might get called on," even if they know they won't. So a case, triggers that reflex. That also makes the abstract concepts you may be talking about more practical. Makes it relevant to an actual individual hypothetical patient. Anecdotes and stories. Works very effectively if you are in an audience that is, let's say, prone to like you. If you're going to tell a story about, I got interested in lupus because my Persian cat had lupus, whatever it is. That's maybe an interesting story if you're talking to a group of friends, colleagues, that's great. You're talking to a larger audience, big room that doesn't know you so well, maybe not going to be so effective in that case. A challenging assertion. This is a very effective, but at the same time, a little risky strategy. In this strategy, instead of kind of making friends with the audience at the beginning, you are challenging them. You're going to tell them everything you know about treating, or everything you know about screening patients for breast cancer is wrong. And so are the guidelines. And whoa, suddenly you have kind of challenged the audience. You basically thrown down the gauntlet, and the audience is going to pay attention to see, are you worth what, are you just BSing me, or are you really badass that you're pretending to be here? And finally, make it relevant to the practice. If you're, what is your audience interested in? What do they need to know? Make sure your content is relevant for them. Regardless of your audience, and regardless of what topic you're going to talk about with that audience, keep in mind that in a 30 to 45-minute talk, they're probably going to forget about 95% of what you say. So what you really need to do when you're creating your talk and editing your talk is come up with a couple basic learning objectives. These are what are sometimes called teaching points or take-home points. So 45 minutes of blah, 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 blah. They're only going to remember maybe 5 or 6 things out of your talk. What should those 5 or 6 things be? Okay? These are take-home points. I've done 3 to 5 learning objectives. If you can vary that a little bit, 3 to 5 is probably a good number. You can get away with a little bit more if you are very clear and simple with them. These could be summary recommendations that you're going to make to the audience. These could be clinical pearls that you're going to give them. If you're giving a research talk, what are the key findings of your research? You know, you're presenting a lot of data, asking lots of questions, critiquing your own research, saying, you know, one of the problems and limitations of my talk is blah, blah, blah. Finally, at the end of all that, what do you want them to remember about what you're going to tell them? For a more broader, you know, thought-provoking type talk, you might be underlying themes. Keep in mind, whatever it is, they're going to forget 95% of what you say, so tell them what you need to remember. I would recommend that you explicitly state the learning objective. It may sound very boneheaded to do this, but just say, these are my learning objectives somewhere during the talk. That's helpful. Audience knows this is what I need to remember. You can organize your entire talk around the objectives. So if your talk has, let's say, if you have, let's say, 4 learning objectives that you want your audience to get away with, you might have 4 sections of your talk, each of which illustrates one of these 4 points. You might present 4 clinical cases, each of which illustrates one particular learning objective that you want your audience to get through. Okay? And again, the classic way people usually do it is to blah, 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 and so in conclusion, these are my learning objectives. And that's fine, that's the way most talks are organized. I've seen a couple effective talks where instead of doing it that way, they reverse it. Up front, they say their learning objectives. Here are 5 things I want you to remember. And then, as you go through the talk, they now have a context in mind, so that when a case comes up, or you're showing some data, those things reinforce the learning concept that you've already given them. It's reminded them of what something you've told them earlier on in the talk, and it helps reinforce them and gives context to any of the data that you're going to be showing. And again, whatever you do with that regard, please do reiterate your learning objectives in the conclusion. That's the last thing you want to remember is your take-home points. That's the last thing you should be telling them before you send them off. Part 2, keep it clear, keep it simple. Okay? The whole point of this section is to help you usher your audience safely through your talk without letting any of the members get lost in the process. So this means creating an organizational roadmap, and we'll go through that very briefly, avoiding information overload, especially when you're presenting data, and then when you're presenting data, we'll give you some strategies on how to make your tables and charts more effective and more easy to understand. Hopefully this will all be clear. The organizational roadmap. Okay. This is something pretty straightforward. Organizational roadmap promotes rapid data sorting, it keeps the audience from getting lost, and it helps tell them what's coming up so it anticipates and preempts questions. What is an organizational roadmap? It tells them where they're going to be going, such as an introduction slide with an outline. You can tell them where they are with it, so in other words, refer back to the outline. And you can tell them where they've been, meaning a summary slide at the end that summarizes the particular learning points. This was the roadmap for my talk. You know, this was so simple, I probably could have skipped it in this one, but I did want to show you the overall organization of my talk in advance. Make it interesting and relevant, keep it clear and simple, look good and entertain. If I wanted to get fancy, I could do things like periodically refer back to my roadmap and say, all right, here we are now. I've shown you that we finished this section. We're now on this section, and we'll be talking about looking good and entertaining you in a little bit. Too much information, TMI. A couple things. This is where, as I mentioned earlier, a lot of slideshows start to fall apart. A lot of presentations start to become hard to follow because there's too much information on the slides. These are rules of thumb. You don't have to follow these rules slavishly. These are some general guidelines. There's a thing called the rule of 7, which says no more than about 7 lines per slide. Okay? You want to get away with 8, okay, no one's going to raise an eyebrow. You have 10 lines of text on a slide. That's a lot. Okay? And people are going to start glazing over. The ones that are really interested aren't going to, but the ones that are only kind of marginally interested in your talk, they're going to start, ooh, that's a lot of stuff to read. So 7 lines per slide is a relatively good rule of thumb. And then 7 words per line. In other words, you don't want words going from one end of your slide, blah, 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 densely going through all the way to the other end of your slide here. Again, giving some space to your slide helps people feel like there's not too much information hitting them at once. A couple other limits, 4 columns or lines, or I should say rows per table. Okay, your tables are fine to have tables. Shouldn't be too long or too tall as far as the number of columns. 4 columns or lines, that's 16 bits, if you go 4 by 4, that's 16 cells there. That's a lot of information to go through. And then if you're doing a graph, no more than about 4 lines per graph or 4 bars or columns per graph. And we'll give you some examples of that. I know you can't read this, but, and you will count the number of times you've heard someone say that in a lecture where they put up a table that looks like this. I know you can't read this, but I'm going to make it easier for you by just highlighting the relevant line here, as if that makes it better. And the guy in the front row, the guy in the front row, I can read it. People in the back row are probably doing this, right now. But I'm going to make it easier by putting that little red brush, as if that makes it all, it's okay. Oh, thank you, sir. What you're actually saying when you do this is, I know you can't read this, and you're getting frustrated, and you're probably tuning out, but I just couldn't be bothered to make simple readable slides. And that's what this is. This is very wrong. This is out of last week's New England Journal of Medicine. I did this last night, pulled a chart out of a table. And in fact, you were allowed, they actually provided you, New England Journal, thoughtfully, if you have a subscription, provides you with the PowerPoint slide from this particular article, so that you don't even, if you're going to present this to your colleague, you don't even need to create your own slide. You can just download this wonderful table from New England Journal, and you're done in 30 seconds instead of painstakingly create your own slide. The trouble is this. These tables and these charts and graphs and everything that show up in the magazines and in your journals, they are meant to be read, not meant to be shown. And that's a very different goal here. When you are reading that journal and you're looking at the table in that print journal or on your computer screen online, you have as much time in the world as you want to sit there and scrutinize the data, read the little fine print at the bottom, look at the legend, go back and look at it again, and you can sit there and analyze it and come to your own conclusions this way. When you're showing data to an audience member, you're not giving them that luxury of time. You're saying, here's the data, blah, 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 blah. 25 seconds later, I'm on to the next slide. And if the people in the audience are trying to figure out what that is, or is that a 2 or an 8, I can't really tell, then you basically lost them at this point. Okay. So, a couple of rules here. Less is more. When you're presenting numbers and you're showing tables, simplify. Use, if the data is not relevant, if you're not going to talk about a number, or a row in a table, or a column in a table, there's no point putting that column or that number on your slide tape, on your slide. So going back to my thing. Look at all this data here. Here's the important part. Oops. If this is all I'm going to talk about, this one line in this entire table, why do I show the whole table if all I care about is want you to look at this one line here? Okay. So, same data in a table you create yourself. This is that same one line out of that earlier chart, earlier table, that I just took it and made my own table. And it's much easier to read. You can look at it very clearly. This is a study that looked at whether an angioplasty on non-infarct vessels done at the time of an infarct leads to better outcomes. I don't want to go into details on this. And it's very simple. The outcome they were measuring was cardiac death and non-fatal MI. Those who didn't have a preventative angioplasty had this complication rate. Those who did have a preventative angioplasty had a much lower one, and you can look at the hazard ratio. If I wanted to show the p-value, I could. Frankly, I don't think that's necessary. I can just tell you, this was highly statistically significant. I don't need to add another column or row to my table to show the p-value. Or I can put a little p less than 0.01 on the bottom here. That's less relevant, because that number is not going to be talked about in detail. What's important is, look, the risk of a complication was dramatically reduced in patients who had a preventative angioplasty. Okay? That's what you should be doing. Similarly, if you're going to use a chart or a graph, same rules apply. You want to simplify things as much as possible. If there's data that isn't relevant, if there's data that you're not going to be talking about, then leave it off your chart. Okay? If you can't do that, if you've got a complicated chart, then break it into 2 separate charts. You don't want to overwhelm people with too much information at one time. Make sure that your charts and graphs are very clear. Titled, everything should have a title, should have a legend, axes should be labeled, and take a few seconds at the beginning when you show that slide to explain the graph. Don't just show the graph up there and assume people are going to understand the relationship that you're showing there. Be bonehead about it. The x-axis illustrates this, the y-axis measures this. The blue line means that, the green line means whatever. It may seem a waste of time, but that information up front will make it a lot easier for your audience to understand things. And again, if you're showing messages, if you're showing your data in a graph rather than a table, you're really there to illustrate a relationship, okay? So you should be talking about the ideas rather than the numbers themselves. If the actual absolute numbers themselves are that important, you should probably go use a table and show the numbers. But if you want to show the relationship, the big idea, wow, look, incidence of this disease is rising dramatically over the last 5 years, then that's where a graph looks best. Okay. So, same data on that angioplasty after MI article that came out last week in the New England Journal. Very simple. It takes a few seconds. What we're looking at here is the outcome of cardiac death in non-fatal MI in patients who either had a preventative angioplasty shown in red or no angioplasty shown in white. And what you can see is that those who had a preventative angioplasty had a blah, blah, blah reduction in their risk of death in non-fatal MI. Okay? I think you can do it this way, you could do it in the form of a reduced table. The last thing you want to do is to copy and paste the actual table out of the article and paste it into your slides. Too much information, too irrelevant, too hard to read. Finally, last few section here, talk about looking good and entertaining. And this, like I said earlier, the most subjective part of my talk, the least evidence-based. Some of it comes from consensus you read. If you go online and you read about how to give good PowerPoint talks, there's some consensus out of that. But a lot of this really is subjective here. So we'll talk about slideshow aesthetics, how to make your slides look good, how to get creative with some conceptual images, and I'll give you some examples of that, and finally a couple speaking tips at the end. So slideshow aesthetics. Form follows function here, and the function of the slides, keep in mind, is to support you as the speaker when you're giving your talk here. The slides are not the point of the talk. You are the point of the talk. The slides there are to support it and to help the audience, follow along what you're saying. Okay? So with that regard, slides have to be readable and easily understandable. You want to maximize readability, maximize comprehension. You are the point, not the slide. So they should not distract from you, and they should not distract from your message. You also want to entertain, and we'll talk about that at the end, as I mentioned, but you want to be creative, but the creativity should have a goal. It should be there to reinforce what you're trying to tell the audience, rather than just being creative for the sake of being creative. So, this part, I think everyone's kind of more or less got this down now. Sometimes they will give you a background template for you to use. Other times you'll create your own. If you're going to create your own background for your slides, keep it simple. Everyone uses dark shades of blue. If you really want to be creative, you can use red or green, but really blue has become the standard because it's easy on the eyes. Plain black, a lot of people do that. It sometimes works, sometimes doesn't. In a really well-lit room, in a bright room, you don't really see black. Black on the screen is not black on a projection screen. So sometimes in a very bright room, the black background doesn't work quite so well. Similarly, a really, really light background, a white background or a really shiny background, if it's a really dark room that you're in instead, can cause some eye strain. So just with that in mind, that's why I tend to use the dark blue. If you want to use simple accents like color gradients, horizontal lines, subdued graphics, that's fine. You don't want to get too crazy. So every single one of my slides in any talk I do has this background in it. Okay, I don't know why I picked it 20 years ago and I've been using it since then. Basically it's blue, mild color gradient, horizontal line just separating the title from the rest of the talk. One reason why I stuck with it is I can now pick slides out of various talks and mix and match them to create new talks, which believe me, as you get on in your careers, you'll be doing that a lot. Because can I give a brand new talk? Can I give a talk for your course? Sure, I'm just like, am I going to create 40 slides? No, I'm going to create 5 slides and then take 35 slides from other talks that I've done and throw them together and tweak them. Oh, and look, they're all formatted nicely because they all look exactly the same. That's the logic here. You don't want to get too crazy with the background. And I think this is the issue. Because PowerPoint lets you create really fancy backgrounds, really fancy animation, there's a temptation to do that. And when I first saw that, it was like, wow, this is great. When I first saw someone do it, it's like, whoa, that is so great. And then, oh wow, he did another crazy transition. About 5 minutes in the talk, I'm going, oh, really? It's like, this is getting a little too much. So keep it simple. Yes, use animation if you want. Use a more creative background if you want, but don't distract from the purpose of the talk. And then formatting text, okay? Again, another common mistake people make is their text is hard to read. You want high contrast, so the white or yellow on blue is kind of your basic standard that works well in almost every circumstance here. Low color contrasts are hard to read, and this is something you don't know until you've done a few talks, and then you look in your slides on the screen and go, oh, shoot, no one can read that. Looking on my screen, I can read this part really easily. It looks fantastic on my overpriced Apple, display. On a, not so great projector in a big room where there's lots of, background lighting and whatnot, contrast gets washed out. So if it's even slightly hard to read, if the contrast is even slightly off on your screen, it's going to be even worse on the big projection. And again, you're not doing a rainbow colored little, My Little Pony type of presentation, but you can use a little bit of color here and there to emphasize words, emphasize sections, concepts, ideas. Okay. And then fonts and sizes. Bigger is better. And you'll see this mistake over and over as well. Tiny little font that's hard to read. 24 points is probably your minimum font size for most purposes. Can you get away with 20? Yes, you can probably get away with 20 if it's not, if the room size is okay, but 20, if it's important for your audience to read, 24 is probably where you want to go. I usually go, something under 20 or under on the little text in the bottom. I'm giving the actual reference there, but and if the guy really wants to write the reference down, they can sit there and squint and scribble really quickly. But that's not so important to me as the actual material. 24-point font. Use a combination of capital and lowercase letters. Obviously, text printed entirely in capitals is hard to read. And people say, you can get it with 2 font styles per talk. Frankly, I think one is pick a single font style, use it for all your talks, because you're going to be mixing and matching your slides in the future, and stick with it. You're not writing a ransom letter. Now let's talk about getting a little more creative here. What I've talked about so far is just kind of how to make things readable and easily understandable. How do you actually, go the step beyond and make things actually a little more exciting, a little more creative, a little more interesting for your audience? Well, one way is to use what's called conceptual images here. I made up this word. I'm not sure what you actually call it. You can use your own name for it. The idea of a conceptual image, in contrast to an image like on a chart or a graph, is you're just using this image to either emphasize a concept. You're not talking about data, you're talking about an idea here, and that's what the image is there to reinforce. Conceptual images do a lot of good things for your talk. It helps break up monotony. If you've got text slide after text slide, oh, here's a graph, text slide, here's another graph, it gets very monotonous after a while, even if you're a really good speaker. And having a picture every now and then just breaks up the otherwise kind of monotonous flow of your talk. You can also use it to add humor. I'll give you some examples of that. As I mentioned earlier, the idea is you can clarify or emphasize a concept visually. You can create a theme or continuity for your talk by using images over and over. I'll just give you some examples here. I was giving a talk years ago about anticoagulants for some reason, and there are a new group of anticoagulants based on Huridin, which many of you people know is a natural anticoagulant found in leech spit. Okay? And after a lot of graphs and charts and text about anticoagulants, you pop up a picture of a guy with leeches on his hands, and whoa, that kind of wakes people up, especially after lunch. So, simple conceptual images, is it really necessary for people to see this? No, you can get away with not putting the slide on, but it breaks up the monotony of the talk, it captures attention again, it emphasizes that, oh yeah, leeches, Huridin, yes, leeches, now I'll never forget that. It was a complicated concept, it was the same anticoagulation talk. I wanted to somehow explain the fact that heparin, the molecule heparin, not only binds to its target, antithrombin, but it binds to a lot of bystander proteins as well, found in macrophages, endothelial, platelet proteins, whatever. So a very easy homemade drawing showing unfractionated heparin